let me ask you, when people snore, this is such a hotbed topic. Um, but when there's someone that snores, how do you know when it's just a sign of someone a little stuffed up snoring, or they've got something more serious that they need to see an ENT about?
That's a great question. I think it's something that affects people of all ages. I think it's important. I mean, to realize that it's actually pretty common. Okay, so when you get to 40 years old, about 50% of people snore. Okay, so
Mm.
that's a pretty high number. Let's talk about what's happening during snoring. It'll explain this process. About 50% or more, maybe 60% of snoring is related to the tongue and how it fits in the jaw. If it's a little bit oversized, if it's a little bit further back, it tends to crowd the area, and it's a muscle that, as you get into deeper stages of sleep, is going to relax, and it relaxes backwards. As you take a breath, you're actually creating suction, which pulls the tongue even further back, narrowing the airway, and then the palate and uvula are being suctioned behind the tongue and are in the way of your breathing. And then that's what's creating that vibratory sound of the snoring. Okay.
Wow.
So about 50-60% of it is related to basically your anatomy in that way. If your mom or dad snore and you look like your mom or dad, shouldn't be surprised that maybe you snore also.
Okay.
It does relate to weight. So if you
Yeah.
gain some extra weight, that relates to narrowing of the airway. And actually, the tongue gets bigger,
When you gain weight?
gets marbled like a prime fillet, right? And it gets bigger. So if you
That's
lose weight,
disgusting.
I know. If you lose weight, your tongue actually shrinks, just like your rings don't fit the same.
Uh-huh.
And so losing weight helps open the airway. There's less crowding of the tissues and the tongue gets smaller. So, the other, well, let's say half of the issue is nasal breathing. So that's important. If you breathe poorly through your nose when you're sleeping, then you tend to open your mouth, which exacerbates the tongue base related snoring issue.
Okay.
So nasal congestion creates tongue base related issues. Okay.
So what's the proper way? Nasal breathing?
Nasal breathing is better because your teeth are together, and it brings your tongue forward. Okay. If you open your mouth, it tends to make your tongue fall backwards.
All
Okay.
right.
And then you can have, let's say large tonsils. That can occur in adults or kids, and then, those kinds of things.
All right. We'll touch more on this when we come back. You're listening to Doctors on Call, sponsored by Northside Hospital, only on 95.5 WSB.